My name is Olivia Rikard, and today I will be presenting to you the signs and symptoms of obsessive-compulsive disorder in individuals. OCD has become one of the most common disorders that is trendy and socially acceptable to diagnose oneself with. But when someone's pencils aren't lined up in a straight row or color coordinated, that doesn't actually mean they have OCD. Living with OCD can be very challenging for some patients, and they find it hard to get through their day. Whether a person is 9 or 29 years old, obsessive-compulsive disorder can be recognized through that individual's behavior and lifestyle.
The early signs of obsessive-compulsion disorder can be seen in children as young as 10 years old. Psychologist Olivia Rikard says in her article, OCD is characterized by obsessions and/or compulsions. Obsessions are recurrent, intrusive, unwanted thoughts, images, or urges that cause marked anxiety or stress. Looking at it big picture, OCD is a disorder every patient wishes they didn't have. OCD is a chronic illness that can affect an individual physically, mentally, and emotionally in their everyday life. For children with OCD, they most likely express a feeling of discomfort or anger when trying to complete a compulsion. Adolescents do not yet have the capacity to fully understand of what they are feeling and might seek help from a parent or adult. While OCD can impact a child's school habits as well as social skills, treatment is best supported when the patient is young. Mental health counselor Katie Lear writes, "Research suggests that exposure and response prevention is the most effective form of therapy for OCD. This treatment helps children to become aware of these compulsions and gives them a strategy to reduce their desire to act on the obsession." It is more common for people to notice signs of the disorder in young adults or when it could have been triggered by a personal crisis. Obsessive-compulsion disorder in adults can be sorted into obsessions and themes depending on the person's situation. An example could look like this. The theme is the fear of germs or dirt, therefore your symptoms include limiting physical contact with others or avoiding touching things others have. With numerous different themes in the disorder, there is no exact way to pinpoint the way each person's anxieties manifest in the symptoms of OCD. OCD contains several subtypes, often called OCD spectrum disorders, such as eating disorders, body dysmorphia, and hypochondriasis. These disorders also share similarities to anxiety and OCD and can be treated and maintained in a similar way. Talk therapy is a great way to start treatment and a chance to talk to a professional about rationalizing one's fears and obsessions. In her article on managing OCD, Dr. Jill Fensky states, "Once a diagnosis of OCD has been established, it is important to educate and support. Evidence-based medical and behavioral therapies are available to reduce the severity and frequency of obsessions and compulsions." Now, let's talk about even more signs of obsessive-compulsion disorder. Have you ever heard someone say, "That didn't feel right," or "I need to do that again," after performing a task? Chances are they are struggling to fulfill this compulsion until their mind says they can. Obsessions can be grouped into a few different categories, such as teaching and ordering, cleaning, superstitions, and constantly checking objects. For someone with OCD, flipping a light switch or tapping a key on a keyboard isn't enough to make them feel stable. Odd numbers like 1 could be a bad number, so they must perform the task 4 times to make it an even number. People everywhere have either seen or heard the phrase like, "I'm so OCD because my room is always organized." For a real person with OCD, they won't be able to move on in their day if their house or car is not spotless. Obsessive-compulsive disorder affects over 2 million people in the United States alone. There is value in being able to recognize these early signs of OCD and compare them with others who also have the disorder. Patients with OCD often find themselves obsessing over completing their compulsions, such as touching, cleaning, or organizing something just to get their mind back in a safe place. So whether you've been diagnosed with OCD or not, it's vital to learn about the disorder and gain an understanding of what these people are going through.